the record, so this one can be the
this one
second part. So, good morning. Welcome to Healthy at Home. So you guys know me. I'm Dr. Melanie Carminati, and today we're getting into part 2 of the low back. I'm going to share my PowerPoint. Give me one moment to get that working. Here we go. And I want to do present mode. Okay, can you guys see that?
Yes.
Okay, great. All right, so you already know this is educational. It is not one-on-one PT, but if you want one-on-one PT, feel free to shoot an email or give a call to that contact info. So we discussed the lumbar spine anatomy, the bony anatomy. We spoke about how the lumbar segments are the largest segments in our spine. They bear the most weight and they allow for the transference of stress throughout the spine. They have discs, as do all other spinal segments, but these ones are larger as it correlates with the size of the segment itself. We spoke about some of the muscles, and then today I wanted to get into more of a discussion on this ligament, the posterior longitudinal ligament. So this ligament actually starts and transitions from the tectorial membrane. So this may be a foreign view for you guys. So what this is part of your skull. So they just like did a cut down through horizontally through a skull down through the upper cervical segments, and you can see that is the start of the posterior longitudinal ligament. So it originates literally all the way up top and continues traveling all the way down. I wanted to put this picture in. I know we're speaking about the lumbar spine, but it's good to understand that this ligament, this thin ribbon-like ligament, travels all the way down. As you can see here, unlike, I'm going to just go back to this one. So as you can see in that view, they cut off these spinous processes. So you're seeing on the inside, they removed the spinal cord. It's just the circular box-like portion of the vertebra itself. So that is where it is, right there. That's where it starts. Now, it travels all the way down to the sacrum, to that lower area, and it covers the back portion of our discs. So we've all heard of people who say they may have a disc herniation, disc protrusion, something of that nature. This ligament, this thin ligament, covers that back part of the disc, runs all the way down from the base of the skull all the way down to your tailbone. So, however, what can happen is if you're sitting for long periods of time in a poor posture, this thin little ligament can get stretched out, as you might assume. So that is why sitting with ideal posture is so important, because this is a thin ligament. In the front of our body, I didn't put a picture in of this, but in the front of our body, there is an anterior longitudinal ligament that actually is much thicker than the PLL. Don't ask me why we were created that way, but it is what it is. So the PLL, that ligament that runs down the back, is thinner. Now, I just want to put this in here because I started speaking with some of you about spondylolysis and spondylolisthesis, all long names, but it has to do with the interarticularis region of the spinal segment. So they colored it here where the stress fracture occurs in this condition. They call this a Scotty dog fracture because if you look at it, it kind of looks like a dog. And then where the fracture is, that's like the dog collar. So the fracture can occur if you it's common actually in gymnasts and dancers, people who do a lot of back bending, because this back part of our spine is mainly for attachments of muscles and ligaments. We're not supposed to be bearing the weight on these spinous processes. We're supposed to be bearing the weight on this big central box-like section of the spine with the discs. That's why the discs are there. That's why this box section is there. So when people arch their back or they're sitting with poor posture in that way, that is another thing that can happen. Spondylolysis or spondylolisthesis. The difference between the two, as you can see here, the spondylolysis is just there's a stress fracture, and then the spondylolisthesis, there's the fracture, and then it actually causes a slight shift in that whole vertebral segment. Just so people can understand. I think I had that on a fade out setting, but anyway, here we are again. So now I bring this up because many times people who have a spondylolysis, the symptoms will refer into the SI joint region. It's not always that when you have pain in your SI joint that it is this, but sometimes this is a consideration. Sometimes it is in fact SI joint dysfunction. However, sometimes it could be this. So it just takes the physical therapist or orthopedist to do a differential diagnosis to figure out what it could be. But just FYI, because I know this is less commonly known and less spoken about. So we already spoke about the core. Yeah, I'm going to just go quick through this because we already spoke about it last time. And we spoke about the treatment. I wanted to just touch on Pilates rehab and the protocol of Pilates rehab. This was also discussed in the Pilates rehab presentation that I did. And I'm just bringing it back in because it's really specific for all kinds of rehabilitation, but most commonly known for low back rehab. So when you're in phase 1, our goal is to reduce the pain, to control the pain. So that's when we talk about the neutral spine that we learned last time, being able to disassociate in your hip and just have that overall core control and stability. This phase also allows for postural awareness in all the planes of movement. Once someone is out of that phase, which it depends. I don't go by the book because everyone's different, everyone's body's different. Some people stay in phase 1 longer than others, and it's very subjective. Phase 2, however, incorporates spine articulation where you're bending and rolling through the spine, doing more of Pilates specific exercises with the chest lifts and the side bending and all of that jazz. Then phase 3, dynamic stabilization, so more challenging exercises, incorporating all of the principles. And then the final phase is movement integration. So this is a progression, Pilates rehabilitation progression that is similar to other physical therapy progressions. However, it's Pilates specific and more movement science based. So movement integration is just taking all of those principles and then progressing someone back to golf or running or dance or whatever it may be, or maybe even advanced Pilates exercises if they're a Pilates student. So I think, okay, so now we're gonna do some exercise. Let me just stop the share. Okay, can you see me?
Yes.
Okay, so we are gonna go down onto the mat again. So if you want to join in, you can join in with these recommendations, or you can just listen and watch.
Why don't I just do this?
So we're gonna lay down onto our backs with our knees bent. If you have a towel or a stretch out strap or a tie to your robe, I would grab that because I'm gonna demonstrate a stretch with the towel. It's up to you though. So we're gonna lay down onto our backs. We're just gonna review the breathing that we did last time, because remember we spoke about the core being those 4 muscle groups. We'll put one hand on the chest, one hand on the belly. Take a big inhale through your nose. Feel that expansion in the rib cage. Then exhale through your mouth. Let all the air out. Again, inhale, breathing in. And exhale, breathing out. Good, do that 2 more times. Inhale. And exhale. Last time, inhale. And exhale. Good, now both hands come to the low belly. Instead of making that mirror fogging exhale, let's make a S hissing noise. So you'll inhale, breathe in, exhale. letting all the air out. Do that 3 more times and notice what happens underneath your hands. Notice if there's a change in the muscle tone. Good, do that 2 more times. And if you have no pelvic floor dysfunction, feel free to also engage in the pelvic floor. Inhale, exhale. Last time, inhale, exhale. So that pelvic floor engagement is a key goal. You can use the image of imagining that air is going up through a straw when you're engaging in the pelvic floor. That will just help you deepen the core engagement. So from here, we're just going to do one phase 1 hip disassociation exercise. So you're going to take an inhale through your nose. As you exhale, you'll engage in your core. That would be the pelvic floor, the deep transverse abdominis. And then you're going to let the right leg open out to the side, only as far as you can keep the pelvis level. Then take an inhale while the leg is open. Exhale, whatever exhale you want to do. And then pull that leg back up to center. Inhale, exhale. Open the other leg. Left leg opens out to the side. Only open as far as you can keep your pelvis level. Exhale again, and then pull the abdominals in to lift the leg back up to center. Good. Now continue to do that 1 more time on each side. So we're calling this hip disassociation because the femur is moving in the hip socket separate from everything else. So the neutral pelvis is being maintained, neutral spine maintained. Remember, we did some pelvic tilts last time. That was to help us find the neutral pelvis. Okay, so we're in our neutral. Now I'm going to just guide you through a different hamstring and IT band variation, because having flexibility in your hamstrings is very important for low back health. The hamstrings insert on your sit bones, and if there's tension there, that feeds into the thoracolumbar fascia that we spoke about last time. So if you have the strap, feel free to use it. You're going to have your right foot in the strap, and you're going to start with the point and flex of the ankle. 10 times pointing and flexing that ankle. Good. And really feel like the heel bone is reaching up to the ceiling as when the toe comes back to you. And then your toes point up to the ceiling. Back and forth. You may even feel this in your calf if you have a tight calf. And that's okay. Now from here, end with your toes flexed towards you and try to straighten out the back of the knee. Now I say the leg should be up to the ceiling, but the real goal is that your right knee stays straight. So if you have your knee bent while that leg is up to the ceiling, I'd rather you lower the leg down more and then straighten the knee. To have the full hamstring muscle stretch, the knee needs to be straight. Keep the toes flexed towards you. Remember, whenever you're doing these hamstring stretches, you want to hold them for at least 30 seconds. So you're breathing into it. Exhale. Again, inhale. And exhale. Good. Now we're going to take this into an IT band stretch. So you're just going to very slightly pull the right leg across the body towards the left. You're only bringing the leg across as long as you can keep the right hip down. Remember, the knee needs to be as straight as possible, and you're continuing to pull on the strap if you have a strap. Breathing into it, taking deep breaths. Same thing here, you'd be doing this for 30 seconds. Inhaling and exhaling. Again, inhale and exhale. 1 more breath, inhale and exhale. We'll bring the leg back to center. Hold it there. If you don't have a strap, you can always put your hands underneath your thighs or underneath the calf to pull the leg towards you. Breathing into it. Take a big inhale and exhale. 1 more time. And then we'll take that foot out of the strap and switch to the other side. So we're going to start with the flexion point of the ankle 10 times. So start moving that foot back and forth towards your face and up to the ceiling. You're loosening up the fascia in the leg that feeds into the fascia in your low back here. Good. Breathing into it. Great. Okay, and then flex the foot towards you and let's hold it there. Keeping the knee straight, remember, so only lift the leg as high as the leg can be straight, and just breathe into the stretch. Taking a deep breath in through your nose and out through your mouth. Again, inhale and exhale, and inhale and exhale. Great, and now we're going to bring the legs slightly across the body towards the right side to stretch that outer IT band. Breathing in through your nose, out through your mouth. Again, in through your nose and out through your mouth. Good, and just hold that stretch there. Again, keeping the knee as straight as possible. Good, and we'll bring the leg back to center for one more hamstring stretch. Inhaling through your nose, exhaling through your mouth. And bend your knee. We'll take that foot out of the strap and put the strap off to the side. Okay, so the last stretch that is very helpful for low back maintenance is the piriformis stretch. Some of you may already know this. If you cross your right leg over your left, it's called a figure 4 stretch also. You cross the right leg over, you put your right hand through that opening in between your legs, the other hand goes around the left thigh, and then you just pull the left thigh up towards you. Now you can use the same strap that you used for the hamstring stretch to put around the bottom thigh to pull up. So that's up to you if you want to use that for assistance. Same thing, you want to be holding it for 30 seconds. 3 repetitions is great if you can do that. This muscle, the piriformis muscle, it originates on the front of your sacrum, and then it inserts out on your hip bone, on the trochanter. So it gets tight when you've been sitting for long periods. Important to stay flexible if you work at a desk or just now during the time of quarantine when you're sitting more than usual. We'll switch to the other side, lower the leg down, cross the left leg over the right, keep that left knee open, and just pull the bottom thigh towards you. Inhaling through your nose, exhaling through your mouth, and inhale, and exhale. Good, and just breathe into that. Our muscles have a rhythm when they're lengthening and stretching, and you just need to listen to that rhythm and honor your body. You never want to force a stretch. Just go to the point where you feel like a moderate discomfort of a stretch. It shouldn't be anything more than that. Big inhale and exhale. One more breath, and then lower the leg down. Okay, so far we did some breathing, we did some hip disassociation, and then some stretching of important muscles in regards to the back. Now I want to have us go onto our sides. So you're going to lay onto your side, either side, with both knees bent. So if you have a little towel or pillow for your head, feel free to use that, or you can just have your head down on the forearm. Now, when we're laying on our side, you always want to first check for your alignment. Ideally, your ears, shoulders, and hips should be lined up. The beautiful thing about having a mat is that you can use the mat as a reference. If you don't have a mat, you can lay down a towel. It's the same thing. So the edge, the long edge of the mat is like a ruler, and I want you to rearrange yourself to reference that line so that you can get nice and stacked in the ideal alignment. So our knees are bent. If you have trochanteric bursitis, where you have the bursitis in the outer part of your hip, you may need to put a little cushion under your hip itself. Obviously, also this is general recommendations. So if you have a hip replacement and it's recent, you'll need to support in between the knees. So remember, everything I'm giving is general. This is not specialized for one person or one diagnosis. So the top leg is going to lift up to the ceiling, keeping the feet together, and then lower back down. Some people call this the Jane Fonda also. So we're just lifting the top knee up, keeping the bottom knee down, and then lowering back down. Good. Keep your feet together. You're just spiraling in the hip joint. The feet stay down, you lift the top knee up, and then you lower back down. Good. And do that again. So next week we start speaking, I believe next week we start speaking about the hips. And this is kind of a segue into the hips, because the hips and the lumbar spine, to be treated effectively, need to be treated together. So we're doing a hip stabilization exercise because stability in the lumbopelvic area is influenced by our hip joints. And relax. Okay. Now we're going to do my next favorite one. You should have felt that muscle activity in that outer buttock area. We're going to do one that I call hot potato. So you're going to hover the whole leg up off the bottom leg. You'll turn in at your hip. Bring that top knee down to touch the bottom knee. Lift the leg back up, turn out, touch the toes. Again, lift up, turn in, touch the knees. Lift up, turn out, touch the toes. We're just going to do 2 more. Lift up, turn in, touch the knees. Lift up, turn out, touch the toes. Again, knees and toes, and rest. All right, you should feel the burn. Those are your hip stabilizers. So we're going to just come up and go over to the other side so that I don't leave you guys off balance. Your knees are going to be bent. Again, check in with your alignment. Use the mat as a reference. Top hand can be down on the mat to help you stabilize. You're keeping that top shoulder also down away from your jaw. And we'll keep the top, both feet touching, and then you're just going to lift the top knee up to the ceiling. And then lower back down. Good. Do that 8 times. Great. As you're doing this, notice the space in your waistline that's touching the mat. See if you can keep that a little bit more active in whatever way that means for you. 4 more. 4, 3, 2, and 1, and rest. Take a breather, and we'll finish with the hot potato. Just 4 reps of hot potato because it's more challenging. You're going to hover the top leg up. You'll turn in at your hip, tap the knees together, turn out at your hip, tap the toes. 3 more times. Knees and toes, and knees and toes, knees and toes, and knees and toes, and rest. All right, nice work. Okay, so we're going to come back up to sitting just to finish up. Okay, so where are we? Let me just screen share again. Okay, so you, okay, good. All right, so today we covered the low back part 2, so we got a little bit more into it. Obviously, everything that we're covering in each session could be weeks long of presentation, but I'm just giving you some tidbits of information, so hopefully this will be helpful for you in your home management during this time. You know that this is a free 30-minute video chat. I am going to be transitioning it, however, at the end of the month to the Instagram Live series. So I'll still be doing some live events, but it's going to be on Instagram or YouTube. So that being said, I will be posting more healthy at home videos on YouTube. They just won't be live. So we got 3 more weeks of this stuff. We're going to be covering most of the body throughout it. So I know you guys will come out that much smarter because of it. So virtual Pilates, the beginner class I teach is Tuesday, 11 a.m. virtual Pilates intermediate. Amarantha is teaching that Wednesdays at 6 p.m. And then you know that myself and my team are doing evaluations, follow-ups, and Pilates one-on-ones. I brought this up last time that I have a webinar if anyone has scoliosis or disc herniations and is curious to learn more. It's very detailed, very extensive about the recent research for scoliosis, especially because that's a hot topic. A lot of people are curious about it. And then disc herniations as well. So if you want to learn more, just shoot an email or you can sign up on the website also.
When is it?
Huh?
When is it?
Oh, it's available now. Yeah, I made it available again.
Oh, it's something that's just on.
Yeah,
Oh, okay.
I took video footage from a live in-person event and then put it into a PowerPoint so that it was like, I made it into a digital webinar that you can watch whenever you want.
Oh, okay. Okay.
Yeah, if you're interested, let me know.
All right.
And thank you. So let's just take the last few minutes to answer any questions.
I'm good. Thank you. Thank you. You're so detailed and thorough.
Just sharing what's in my brain, that's all.
What's going on?
What'd you say?
Lots going on in there.
Well, lots of schooling. We have to get our doctorate, so they definitely put stuff in there.
Yeah. But where did you get your doctorate from?
Drexel University in Philly.
Oh, wow. Is that where you're from?
No, I'm actually from Long Island, although most people don't believe that, but I am.
That's great. Well,
I
thanks a
don't
lot.
have the accent, but my dad does.
Oh, yeah. Yeah.
I mean, I don't have the Brooklyn accent, and so, it's a different Brooklyn that has the accent.
It's true. I think that's what it is.
Yeah.
Okay, guys. Well, stay safe, stay healthy, and I'll see you next week, okay?
Thank you. Bye-bye, Melanie. Take care.
Bye.
Bye.
Have a good weekend. Thank
Bye.
you.
You're welcome. Bye, Jeannie.